and welcome to episode 2 of the Zesty Dietitian podcast. I'm your host, Mackenzie Caldwell, registered dietitian. I'm so excited to have my very first guest on the pod today, Dr. Colleen Connolly. She is a physical therapist based here in Charlotte, North Carolina, and she specializes in pelvic floor health. And I'm just so excited to interview her today. She is a colleague and a friend, and she's so knowledgeable, so compassionate. And I really just can't wait to dive into this conversation with her and for you guys to be able to listen to that and learn from her as well. She's just such an amazing pelvic floor PT. So a little bit more about Colleen. Her passion lies in the treatment of pelvic floor orthopedic and sports injuries. She has extensive training and experience treating all people with pelvic floor diagnoses. She aims to provide a human-centered approach, addressing both the physical and emotional aspects of pelvic health. Whether you're experiencing pain, discomfort, or seeking preventive care, her goal is to empower you with knowledge, mobility, and strength training and hands-on techniques that promote healing and regain your confidence in your daily life. Colleen is also a Pilates instructor, which is super cool, and teaches private Pilates and group classes. In her free time, she enjoys hiking, reading a good book, exploring Charlotte's food scene, and spending time with her Bernedoodle, Bosun. Here we go. Let's dive in to my interview with Dr. Colleen Connolly. All right. Hello, Colleen. I'm so excited to have you on the podcast today. How are you doing?
I'm good. I'm so excited to be here.
Yeah, thank you so much for taking the time out of your day to join us. I know that pelvic floor health in general is just so freaking important and not something that most people think about either. So I'm really excited to get chatting with you. So I really like something I ask all of my clients is a little bit more about kind of what kind of foods they like. And I was like, you know what would be really fun to do? Ask my podcast guests the same questions. So what are some of your favorite foods, Colleen?
Oh my gosh, don't even get me started. If you ask any of my family members, any of my friends, I just love food in general. So if you put something in front of me, I'm probably going to eat all of it and scarf it down. But I'm definitely known for having a sweet tooth. So anything like baked goods, cookies, brownies, any of that, definitely one of my favorites. More on the things that fuel my body though. I'm a big sweet potato lover. I actually went through a phase, like you can ask some of my PT school friends. I would have like a salad with like chicken, all of that, and then a half a sweet potato for lunch, like for probably 3 or 4 months at a time. It was a little obsessive, but
that's awesome.
I love sweet potatoes. And then I would say, of course, I think like I'm a big carb girl, so pasta, pizza, anything that you find in an Italian restaurant is definitely up my alley.
Love that. I have a big sweet tooth too. And something I like to make sure my clients understand too is that like sweets can fuel our bodies too. No, they don't have like fiber, but that's okay. Where our bodies need glucose regardless. All food is fuel.
100%.
Some foods just have additional nutrients as well.
Yes, I have dessert every single day. So definitely something I tell all of my clients as well as like sugar is not something you have to give up.
Absolutely. I'm right there with you. And what are some of your favorite ways to move your body?
Oh my gosh. Same thing with the food. I just love everything about movement. So I'm a big, right now, of course, I think you know this, I'm a Pilates instructor. So I love Pilates. I've been doing Pilates for, since I was like 17 years old.
Oh, wow.
So it's definitely been a process with like learning how to move my spine, learning how to move my body in that way. But just recently, I would say in the past 5 years, I've gotten more into weightlifting. Definitely building strength and doing more heavy lifts. So barbell weights, kettlebells. I definitely have found joy in strength training, which I used to really avoid in my early 20s. I was just big like cardio hit girl. If I felt like I wasn't sweating like within the first 10 minutes of a workout class, that it wasn't worth it. But I've changed my mindset completely. I can do workouts now and not break a sweat and still feel like I had a really good workout.
Yeah, that's awesome. I love that. I just started lifting weights myself. I don't know if I had
Oh,
told you that.
so
Yeah.
good.
I did physical therapy for some stuff and then like was trying to level up on my own and I just kept hurting myself because and I'll ask you more about hypermobility, but I was like, I can't do this alone. So I hired a personal trainer and it's been so much fun. And I love it. Yeah, like I don't have to break a sweat. Like if I decided to do the exercises she gave me, even like half of them, it would take me 15, 20 minutes. And I could get that kind of like mental health boost and my body would feel good. I feel like I get some energy out of my body a little bit, but I don't feel like I have to like totally take a whole shower like I do if I take a yoga class that's a little bit warm, shall we say. So I
Exactly.
love
Yes,
that.
those hot yoga classes can get us for sure.
Oh my gosh. And I can't even do hot yoga. Honestly, my body can't handle it. But there's a class in town at Kali Yoga in Noda. If for anybody listening that's local to Charlotte. And they have an outdoor indoor class, which is so fun. But if you do it in the summer, it's essentially a hot yoga class. So yeah, it's a
Yes,
lot.
especially in North Carolina.
Oh my God. Yeah, for sure. Um, yeah. So
That's
I am
awesome.
super curious. How did you decide to become a physical therapist?
Oh my gosh. Yes, long story, but I guess we have some time to to go
Yeah.
through that. So when I was going to undergrad, I actually entered my undergrad as an engineering major.
Oh,
I
wow.
like was a math nerd in high school. I loved chemistry. I was like a girl that was like sitting in the front row of my calc class. I was like, I love math. And then I got to undergrad and started taking more higher level math classes, engineering classes, and I really ended up hating it.
Hmm.
I wasn't doing well. I was like, this is just not for me. Just talking to a lot of my like fellow students, like they were just like so excited about it. And I realized I didn't want to be like stuck behind a computer all day or just doing like Excel spreadsheets and
Hmm.
all of that fun stuff for the rest of my life. At least that's what I thought. I mean, freshman year is definitely a time where you're figuring your. Um, so my oldest sister is she was in chiropractic school at the time.
Hmm.
So talking to her, brainstorming what kinds of things interested me, interested and like sparked my desire of just changing majors. She was like, "What about like exercise science? Like you were an athlete, you love working with people. You
Hmm.
should look in exercise science. There's so much you can do." Of course, she was like, "Come to chiropractic school. You should be a
Yeah.
chiropractor like me." And then I started working at a local physical therapy practice as just like their front desk as a tech, kind of
Hmm.
helping around the clinic. And I just loved the fast paced like
Yeah.
environment. I loved working with people. I loved learning from, there were about 4 or 5 different physical therapists and just being able to
Mhm.
learn so much from them. And so that kind of sparked my desire. I was like, you know what, I think this is the right career for me. And then got a little bit more serious, changed my major, went through all of the education to be able to apply to PT school.
I love that. That's awesome. Yeah, I feel like a lot of people feel very kind of if they like math and science feel very kind of like cornered into like being an engineer or being a doctor, but there's just so many other careers too that you can go into and can be like your high achieving, people loving self too. So I love that.
Absolutely.
Yeah. And
Yeah.
how did you end up, because I know that like pelvic floor PT, from my understanding, is kind of a specialty, right?
Yes, it is a specialty. So I do not have my certification that you have to go through a whole test for. But
Mm,
as a pelvic floor therapist, you can specialize in sports. You can specialize in pelvic floor. You can specialize in like lymphedema care.
mm.
You can become an acute care PT or neurological PT. So there's so many things that you can do with a physical therapy degree. I think all of my classmates that I'm still close with we're all doing completely different things with the same degree. So you have to, if you choose to go through pelvic floor therapy certification, you have to go through different continuing education courses to get certified for doing internal exams, for really treating all pelvises, male, female, things like that. So yes, specialty for sure.
Yeah, absolutely. So in your practice, it sounds like you do a little bit of the pelvic floor stuff. Tell me how you kind of got interested in like the women's health perinatal world.
Absolutely. So it goes back to when I was a tech, like in undergrad. One of the physical therapists on staff, actually, I think she'd been a physical therapist for probably 4 or 5 years at that point. And she became really interested in the pelvic floor. So she ended up going through continuing education classes and then starting her own certification process, specialty. So I got to work a lot with her and her patients, and just seeing the difference that she made in their lives was astronomical. I mean, I was used to seeing, a knee surgery, a total knee replacement, or a total shoulder replacement. And yes, like it is still so fulfilling. You still get these patients back to doing all of the things that they love. But then I was seeing, women come in postpartum that were peeing themselves. And then a couple visits later, they're like, oh my gosh, Lala, I haven't peed myself in like 3 weeks. Like I'm able to leave my house and go to dinner with my friends and not feel embarrassed about it. Or I would get see patients that had been married for 4 or 5 years and have never been able to have sex with their husbands. And working with her, they were finally able to conceive and start their own family. I mean, it makes a astronomical difference in these women's lives, as well as males, right? So like men coming in that are having incontinence or pain and not able to have intercourse, or just aren't living their normal daily lives, just kind of holed up in their house because they're ashamed or embarrassed of what's going on. They're able to get out there. So I think seeing that, and then my own experience as a patient, I was a patient of a pelvic floor therapist when I was actually in PT school, and she changed my life. I was like, I didn't even know I had my own pelvic floor problems. And just seeing her for like 3 visits, I was like, oh my gosh, changed my life. Sign me up. I'm going to be a pelvic floor therapist. This is perfect. I found my specialty.
I love that. That's awesome. And I felt the same when I went to PT just for like some hip and back pain. I have a stress fracture in my L5, my lower spine, for anybody who doesn't know what an L5 is. It's fine. I live with it. It's okay. It like just flares up every once in a while. Just have to be like careful. And, but some of the things I need to do are, I know I need to keep my core strong. Like I did basic PT in high school, but, I ended up seeing another, PT in town who happens to also have a pelvic floor specialty, and, learning about just how connected everything is with like, what's it called? This pelvic sling with like the muscles. Is that the correct terminology?
You're on the right track. You're on the right track. Absolutely. Yes. Like how all the muscles in our pelvis are connected to our low back, our core muscles, our hip muscles. We have so many muscles that attach inside the pelvis and outside the pelvis. So it's definitely like the center and the core of our body. So I find pelvic floor therapists can really look at the whole body in that way.
Yeah, absolutely. It was definitely really like just to be able to connect with my body even more and kind of understand more of what's going on and get that like mind body connection. And just learning how like my breath is connected to the muscles in those area too was really, really interesting. So yeah, I love that. What is one thing that you wish more people knew about the pelvic floor?
Oh my gosh. Well, I wish they knew a lot of things about the pelvic floor, but if I had to choose one, I would probably say that we think that pelvic floor just means like strengthening or just doing Kegels. Like people come to me all the time for pelvic floor therapy and they're like, I don't get it. I've been doing Kegels my entire life. Like my doctor, my OBGYN, everyone has told me to do my Kegels and I've done them my entire life. But I have found so many people need the complete opposite. They need
Mm-hmm.
to not do Kegels. They have an overactive pelvic floor, or what's called a hypertonic pelvic floor, or muscles that are having a really hard time actually relaxing. And if like
Mm-hmm.
any muscle in our body can't or doesn't know how to actually relax, then it's just going to be tight, and it's probably not going to be super strong. So doing
Mm.
a Kegel is basically just like your bicep. Say your bicep is like this all the time, and you're just doing bicep curls like
Mm-hmm.
that all the time. You're probably not going to have a super strong bicep. You're not going to have those guns. So we want to be able to teach people how to actually lengthen their
Mm.
muscles and then strengthen it all the way, so they're moving through their full range of motion.
Yeah.
And we can do so much without a Kegel.
Yeah.
So much.
And I'm so glad you said that as your answer, because I was just walking my dog and I was like, I really hope she talks about Kegels, because I feel like that's the one thing that I hear like all of my pelvic floor PT. Now I've like made some more colleagues and friends in the kind of perinatal world. All of you guys kind of preach that. And I don't know where that comes from. It's kind of like, I don't know where this idea, some of part of me kind of feels like it must have something to do with kind of like I don't know, something like why is that a thing? Why do we think we need to do Kegels?
I mean, I think there's so much, like, there's so much history on even just society thinking that women need tight pelvic floors.
Yeah.
And I mean, I know when I was growing up, jokes all the time, like, oh, yeah, she's had 3 babies, like her pelvic floors like so loose, it's like throwing a hot dog down a hallway, and things like that. It's
Yeah.
like, why? Like, it's just this like perpetuation of this thing with expecting women to, I think it gives the men maybe more pleasure and things like
Yeah.
that. I've even had, horrific stories from some of my patients of doctors putting in an extra stitch. They call it the
Right.
husband stitch and things like that. But I think that narrative is just so problematic, and we have figured out that is not true.
Yep.
And actually, it's completely the opposite of what we want.
Mm-hmm.
When people have really tight pelvic floors, they can't usually orgasm as well. They probably can't have intercourse as much.
Yeah.
Like, we want to have flexible and relaxed pelvic floors, not
Yeah.
not the
Yeah.
opposite.
Absolutely. Are we even surprised that basic anatomical kind of structure is just completely misunderstood for the sake of male pleasure? Can't
Oh,
say,
I
yeah,
don't think
yeah,
I'm not surprised.
not surprised,
But yes,
but yeah.
I think we're coming a long, long way. I think there's so much more research that still has to be done. But I've
Mhm.
seen even the past like 2 years, like I know 4 years ago, people were still giving Kegels to patients. So it's
Yeah.
transformed, I think, with social media, with TikTok, with just being able to get more education out to all pelvic providers, doctors,
Mhm.
and just more research that has been better research.
Yeah, absolutely. And I think even in the nutrition and dietetics world, we're starting to talk about the importance of referring to physical therapists for pelvic health issues, like constipation and or like period pain. And even just now, I just ask my patients, either the ones that are really like that I've kind of heard might be at risk for pelvic floor issues, like athletes or in pregnancy, like, are you having any pain or difficulty with like leaking or anything like that? And then kind of helping them understand how a pelvic floor PT might be able to help them too. So I love that we're getting the word out overall.
Yes, and we appreciate it. We appreciate all your referrals and you getting the word out there. And we're trying to do the same thing for you. Like dietitians, nutritionists, like we are really like when we see those flags coming up, like people not fueling their bodies, people having more just under eating and things
Mhm.
like that. Like we really try to push for like we need you to work with someone. We know this much compared to what you guys know. Like we
Yeah.
sat in PT school, I think I had 2 lectures on nutrition, and that's not enough. That's really not enough. And so I was like, these people go to school for as long as I go to school for, just for nutrition. Like, you need to be seeing them.
Yeah, absolutely. We appreciate that too, 100%. And it's like, yes, I wish that more providers had more education in nutrition, but it's also okay. Like, I don't know how to do physical therapy for somebody. Like, it's just okay. That's why our separate professions exist, so that we can specialize and support people kind of from that like holistic team-based approach. So,
100%.
but yeah, you were kind of talking about under fueling. And that was one of my questions for you, is that in our practice, we see a lot of folks who are under eating or over exercising. So with your perspective as a physical therapist, can you talk a little bit more about how overtraining can harm the body?
Absolutely. I do see it a lot with, ex-athletes, with especially women getting like back to exercise postpartum. They think they need to go harder than ever to
Yeah.
bounce back or
Mhm.
lose the baby weight and things like that. But I really try to educate my patients on the importance of not overtraining, and why it's so important not to overtrain is because our bodies really do need that recovery. How muscles grow stronger is actually through that recovery period, not so much just the strength training period. So I'll
Mhm.
have people come to me like, I don't know why I'm not losing weight or getting stronger. I work out 6, 7 days a week, like for 45 minutes to 2 hours, and they're doing HIIT workouts, they're running, they're
Yeah.
strength training, they're doing everything. They're just like throwing the whole kitchen sink at their body. But explaining to them, like, if your body doesn't have a chance to have that recovery period, and that recovery can look different for everyone.
Mhm.
Recovery might look like just a gentle 20-minute walk a day. So you're still getting activity,
Mhm.
but you're not going like all out sprints for 2 hours.
Yeah.
And so when there isn't that chance for muscle recovery, it's really actually like harming the muscle. So your body has to have calories, your body has to have things that help regenerate and regrow that muscle.
Mhm.
Versus if we are just like pounding the muscle again and again and again, it is just breaking down that muscle. And that can lead to so many things. It can lead to stress fractures, it can lead to actual fractures, it
Mhm.
can lead to rhabdo, which is
My gosh.
not
Yeah.
fun. You'll see that a lot in high level athletes that aren't having enough muscle recovery. And
Mhm.
it's basically your body is telling you and actually using your muscle as fuel versus calories and fat
Yeah.
and all the things that we need. So there's a lot at risk. You're just putting yourself at risk for injury when you don't have that recovery period. And
Yeah.
then it's doing the opposite of what you want. Then you might have to take more time off, and then you
Mhm.
might have more weight gain and things like this, that are the opposite of sometimes your goals. So really, it's a fine line trying to figure out if people are overtraining or undereating or doing a combination of both. But
Mhm.
really, especially for my women, it I've it's a trend I see a lot in the postpartum period, is they
Yeah.
think they need to eat less and work out more in order to reach their goals, and that is the opposite of what we need.
1000%. Just like we're healing from giving birth, we know that like if you were to have a major surgery or go through some sort of like major trauma, you would need a heck of a lot of calories and protein to be able to recover from that. So even if you, and then if you decide to breastfeed on top of that, then you even need even more. And so if you're depriving your
Mhm.
body of those things, then you're not going to be able to recover appropriately. Um, and I think some people have this misconception that they only need protein for recovery, but you actually also need carbs too, because glucose
Mhm.
is the body's primary source of energy. And if you're not getting glucose, then your body will break down protein in order to create that glucose. So we need both for sure.
Yes, 100%. I have that big conversation with a lot of my, I would say it's definitely, I think low carb diets are more, just from my experience, more trendy with, I would say more like premenopausal, menopausal women.
Mhm.
And so they're like, oh, I haven't eaten carbs in 20 years. I'm like, that
Oh my gosh.
is definitely something we need to talk about. And they're coming in and dealing with a lot of constipation
Yep.
issues, a lot of things regarding just not having good, strong muscle. So we talk a lot about like carbs are not evil.
Yeah.
Carbs are our body's way of fueling. Of course, like it takes a lot. And that's when working with nutritionists and dietitians come into play, because it's probably not just going to be one conversation with me that's going to change their mind. It's 20
Yeah.
years of that theory and that mindset. And if we're introducing strength training, if we're introducing higher volumes and higher weights to get stronger, like we
Mhm.
need fuel to match that. We
Yep.
don't need to keep this 12,000 calorie diet and under as we're continuing to build up our training. We need even more calories, we need more fat, we need more protein, we need more nutrients that feel good. And that is definitely sometimes a struggle for a lot of my patients,
Yeah.
but it's definitely a journey that is worth it,
Mhm.
and can definitely save your life.
Yeah, 100%, 100%. And I think even now, the low carb diets are really popular for patients with PCOS. And what's cool about PCOS, even though it's a hormonal condition that can be really unfortunate in a lot of ways, is if your testosterone is naturally higher, that means that you're also going to be able to build muscle more easily than some other people, which is super cool. So if we think about like, okay, like shifting this perspective from body control, weight control to just being stronger and happier and healthier overall, if we fuel your body appropriately, yes, give you the protein you need, help you understand how to balance your blood sugar overall, but like not cut out the carbs, then we're going to actually give your body the true fuel that it needs in order to be able to build muscle in whatever way kind of matches your goals in the long run too. So yeah, and I think kind of hearing you talk about kind of perimenopause and postmenopausal women, like a lot of my patients are kind of in their more reproductive years, and kind of understanding how we can break that cycle. We don't have to waste 20 years. Like, let's say it's been 10 years for you now of dieting. Like, we can stop now. We can end the cycle now. We don't have to get all the way to that point. So, yeah.
100%.
Yeah. Um, Going back to period pain, I refer patients to PT all the time if they have endometriosis. But I'm just curious, like, what do you do with a patient that has endometriosis? What are you actually helping them with?
Absolutely. And so endometriosis is so much more common than we think. And I
Hmm.
think so heavily underdiagnosed. There's actually some great doctors in Charlotte. We're very lucky that specialize in endo and do what's called the gold standard surgery. Like
Hmm.
if surgery is in their future, or if that's something they want to actually consider. Right now, what they are is the gold standard is what's called excision surgery.
Hmm.
And so actually getting the endometriosis out of our body, which it used to be more ablation, they found out that it would just grow right back.
Yeah.
And so there's actually fabulous surgeons, fabulous doctors here that do that surgery. We're very lucky as a city to have that. And so I get referrals a lot for endo.
Hmm.
And what can happen is with endometriosis is a lot of pelvic pain, like you
Hmm.
said. So a lot of painful periods or just painful like ovulation,
Hmm.
painful low back pain, hip pain, things like that, that they've kind of just brushed off as endometriosis. And so I've even had some patients unfortunately have some doctors that still believe that hysterectomy is the best treatment for endometriosis and
Hmm.
have had hysterectomies even scheduled. And luckily, they were referred to me before. And they're coming in with hip pain, low back pain that actually might be more orthopedic. But
Hmm.
they believe and have been told that it's all coming from their endometriosis. And I do still believe that endometriosis, because of that hormonal cycle, can elevate our pain levels quite a bit, like especially before ovulation and when we're on our cycle. And so you might have an increase in that pain when your menstrual cycle is coming, but it's kind of still in the background the whole month. or the whole year.
Yeah.
So we look at more of these patients, I believe, from more of like an orthopedic standpoint at first. So
Mm.
seeing how their body moves, seeing how they're functioning, doing a full assessment outside of the pelvis and looking how their whole body is actually
Yeah.
moving. And we get a lot of success with just treating him that way. And then, of course, doing internal pelvic exams, seeing if there are increased tone of the muscles, if there is more tension in the pelvic floor. And if we know anything about muscles, when there's increased tension, there could be increased pain. And so that's not always true for some people. Some people are super, super tight and are walking around just fine. But for some reason, a lot of times what we have found is increased tension can elevate people's pain levels. A lot of my patients, unfortunately, have trouble having intercourse or having orgasms, things like that. So we work a lot on pelvic floor relaxation, teaching them, like I said earlier, how to actually lengthen their pelvic floors. And that has seemed to help quite a bit for these patients. Of course, as a pelvic floor therapist, I'm not going to change the endometriosis. I'm not going to change the actual structure of what's happening in their body. And I'm not even going to change like hormonally what's happening. But I can change how our how we respond to pain.
Yeah.
That I think is in and of itself, like teaching them that they can be in control of the pain sometimes versus the pain controlling their lives. So giving them strategies, giving them tools to help reduce their pain in that moment. It might not, reduce the risk for pain completely. They probably are still going to have discomfort and are still going to experience their symptoms at some point during the month. But at least now they have tools like, what can I do to help decrease my pain, to alleviate some of this? I have stretches, I have exercises to be able to do when I do feel my symptoms, and then slowly building them up. So once they finally understand like how to relax their pelvic floor, then strength training. Like what we know about hormones and what we know about the body is that strength training can be wonderful for my patients with endometriosis. And so teaching them to move their bodies in ways that are healthy, are putting them at risk for injury, and then building up their muscle. Research has shown that has helped a lot of patients.
That's so cool. I didn't know that about endometriosis specifically and how strength training could help. But strength training really does help with, well, I mean, muscles can be hormonally active. Like they can absorb or like react to hormones. They can release hormones. So I'm not entirely surprised to hear that, but that's super cool to hear more about that. And I feel like I've heard a little bit about kind of like adhesions and how sometimes there's some like body work that you guys can do if there is like built up scar tissue or anything. Tell me more about that.
Absolutely. And so I definitely use what's called like manual therapy with my patients. I think it's a great tool as physical therapists that we all should know how to do, and we should be able to teach our patients how to do. So I might work on the scar tissue and the tension in their body, and what's called the fascia that might overlay their organs at the time. So I think of it kind of like a shirt that might be wrinkled. So if you look at my shirt right now,
and this is for people that are watching on YouTube, but if you're listening on podcast, Colleen's just showing her shirt, her t-shirt.
Yeah, so just showing my shirt. And so when you kind of tense a shirt or tense that wrinkle, it is going to pull on the rest of the shirt. So that's basically just a nice way to show what fascia really does, like when there's like restrictions or scar tissue. So same thing with C-sections, like we work on C-section scars a lot in pelvic floor therapy. So if there's any sort of restriction at that site, it just shows there is this kind of like overflow effect for the rest of the system. And so, yes, I might work on their abdominal muscles. They might have some tension, or they might be having things like constipation. So being able to move and bring blood flow to all of that area can be super, super relaxing for some of these patients. And teaching them how to use it at home as a tool instead of just throwing their hot pack on there. Which most of us have done during like menstrual cramps, is just lay in a ball with our hot pack on our bellies.
Yeah.
So teaching massage can be super, super helpful. I am a big believer that our hands don't break up scar tissue. And so I think that gets
No.
misconstrued a lot with some physical therapists, some medical professionals, that we're breaking up scar tissue. That's not what's going on anatomically, but we're bringing blood flow to the area. We're bringing all of that fluidness back into our muscles, into the fascia, and so allowing our muscles to move a little bit better. But scar tissue is strong, so we're
Yeah.
not going to make changes with that. The only way to make changes to scar tissue is actually to cut it out of your body. But scar tissue is sometimes a good thing, especially post surgery or post anything. That is your body's way of healing itself. So we just want scar tissue to be able to move like the rest of our tissue. That's
Yeah.
the goal. It's not
Yeah.
about like breaking it up or getting rid of it. It's just making sure that it's moving a little bit better.
Cool. Yeah, that's awesome. The body does have really amazing ways of healing itself. And sometimes we need to just kind of like respect that and just support it in doing its thing. And yeah, that's really cool to hear more about. Um, so we were talking a little bit about earlier how I am hypermobile. And one fear I have for myself is like, oh my God, if I get pregnant, I know that like relaxin is a hormone that increases in pregnancy. What the heck? Like, am I just going to be like, is my pubic fit symphysis just going to like pop itself open? Like maybe that's an irrational fear, maybe it's not, but how would you work with a hypermobile patient if they became pregnant?
Absolutely. No, I think that is a very, very common theme. And you would be surprised. I find a lot more of my pelvic floor patients to be hypermobile. And so
Yeah.
flexibility is not something we need to be working on. Like they're plenty flexible, like their muscles know how to lengthen. However, I have found that their pelvic floor might have compensated for that excess flexibility in their body. I'm a big believer with hypermobility that hypermobility is not a bad thing, right? We don't need to fix hypermobility, and hyperextension is not evil. Like that is how your body was made, and that's how your body functions, and you're perfectly like walking around every day, not in like so much pain all the time. But I found with some of my patients that have hypermobility is that their pelvic floor has become so tense to find that stability. Like your body is smart, and it's going to find stability in parts of your body to help compensate for maybe excess flexibility other places. So we teach them how to actually relax your pelvic floor without just like overstretching and doing just like happy baby all day long.
Yeah.
So how to actually use your diaphragm, like you talked about earlier, use your breath, because your diaphragm and your pelvic floor work together. They're like sisters. So as soon as we take a deep breath, your diaphragm moves down to allow your lungs to expand. Your pelvic floor naturally should actually move down to allow for that increase in pressure. And then when we breathe out, our diaphragm moves back up and our pelvic floor moves back up. But for some people, their pelvic floor is like a concrete sidewalk and it's not moving up and down at all with our diaphragm. So teaching them how to tune into their own bodies, work there, and then we start working on stability. So finding stability with our pelvis, finding stability in our core muscles, finding stability in other places in our bodies. So shoulder strength, rib mobility, and making sure we're having really strong what I call like push-up muscle. So you have this muscle underneath your shoulder blade, your serratus anterior. I found a lot of my females, that muscle's fairly weak on most people. So I actually do a lot of push-ups with my pelvic floor patients. So I do, it's actually my last patient that was just here. We worked on push-ups. So being able to use that stability in your upper body, teaching your body how to use your breath with it, and seeing, are you overcompensating? Are you just tightening your pelvic floor the whole time to be able to do this? Or are you able to be flexible and kind of bring softness into your body in that way? So I would say if you are pregnant, there are so many things that we can work on. So it really depends on symptoms, depends on goals, whether your goal is to have a vaginal delivery versus C-section versus if you're having back pain or hip pain. But typically I work on, can you relax your pelvic floor first? So teaching you for that full range of motion. Then once we find that full range, teaching you how to use that full range with stability, with strength training, which I love that you're doing with your personal trainer. And then maybe getting closer to delivery, we're working on still how to relax that pelvic floor, different birthing positions, things that feel comfortable for your body. I'm a big believer in having whatever birth that you feel comfortable, that you feel empowered, that you want to do. There is no wrong way to deliver a baby as long as you are safe and baby is safe. So I think that sometimes gets out there, like there's like, I shouldn't be on my back for delivery, or I can't have a C-section. I want to avoid a C-section. But training, especially in the third trimester, most of my patients, and let's look at all of the options. What do you feel safest with? What do you feel most comfortable? And I promise, like, whatever is in your mind now for delivery, it's probably going to change in the delivery room. So just having all of the options in your head and getting on board with what could happen and what might happen.
Yeah, absolutely. Awesome. I love that. It sounds like there's just no matter kind of what your body is, we can kind of just honor the way that our bodies naturally are, notice kind of where the pain is happening, and kind of support it from literally from the ground up, from the pelvic floor up, which is super cool.
100%.
And yeah, I love that. I definitely feel a little bit better about the idea of at some point.
I don't think your pubic bone is going to pop out of place. And so, of course, if you start to have pubic symphysis pain or pubic bone pain, come see me. But I think there are so many things that can help support my patients who are hypermobile from feeling better. But you're already doing amazing things with strength training. That is like one of the biggest things I tell most of my hypermobile patients.
Cool. Good to know. Good to know. I appreciate that. And so like, even for yourself, if you were to become pregnant, and I don't even know if you want kids, you don't even have to share that here if you don't want to, but if you were to become pregnant, like what kinds of self-care things would you be working on, for a healthy pregnancy and healthy postpartum?
Absolutely. And yes, I do want kids eventually. And so, not anytime soon. I don't think I'm like mentally prepared for, I can like barely handle myself and my dog right now. So that is all like that my mind can handle. But eventually in the future, I mean, I've definitely thought about it. Like my friends laugh at me because I'm like one of those people, I'm like super excited for pregnancy. Just because I have seen so much and I think I'm mentally prepared of like what could happen, what shouldn't happen, things like that. My goal, of course, I find every pregnancy is different and depends on how I'm feeling, how, like, if I'm having a lot of nausea, if I'm able to sleep and get good sleep. But sleep is going to be my number one thing I prioritize. I am a big, like, I love sleep. Like, I could sleep for like 10, 12 hours straight. And like, that is like the best night of my life if I'm just like in my bed sleeping. So that's going to be the number one thing I prioritize. And that is what helps muscle recovery. That helps nausea. That helps you being able to eat the next day. I know all of us have gotten 3-4 hours of sleep and felt nauseous. We haven't felt good. So sleep is my number one. Hopefully able to continue exercising. That is definitely my number two. So as much as I can, getting out there, going for a walk, continuing to strength train is the biggest thing. Once you kind of hit a point in your pregnancy that you feel like you can't strength train, or people have been told by their doctors, like, hey, you shouldn't be exercising right now, I find postpartum recovery to be a lot harder, right? So like any surgery, like if we told a knee replacement, hey, don't exercise for 6 months before the surgery, they're going to have muscle atrophy. They are going to have a really hard time recovering from that surgery. And I think of it from that same mindset of pregnancy. Of course, every pregnancy is different and there are risks, there are benefits to exercise, but doing as much as I can that's safe, that isn't putting myself or baby at risk, that is my goal. And then thirdly, nutrition. Nutrition is the biggest thing, is like fueling my body, eating what I want, number one, but also giving my body good nutrients, good minerals, every good fats. We know that fat is a good thing, especially for nerve development and for brain development of, I mean, our own bodies, but of course, baby. And then just making sure that I'm getting plenty of protein and water.
Yes. Love that. Love that. And those are such basic self-care things. So I love that. Kind of, those are some things that like anybody could focus on. And it's not like you're
Those
like,
are the
I'm going
main
to
things,
do
yes.
15 sets of Kegels every 5 days, whatever. No, we're just sleeping. We're moving in ways that feel good. We're eating balanced, tasty meals, getting enough of the things that we need. So I love that. That's great.
Absolutely.
Good. Well, it's been so fun having you on the podcast, as my very first interview. So thank you so much for coming. Do you have any final thoughts for us before we wrap up today?
I don't know. I think just my final thoughts is that everybody should have a pelvic floor therapist in their phone, someone that they can talk to, or even just shoot a text message to. Everybody should go see a pelvic floor therapist, in my opinion, as well as everybody should go see a dietitian, aka go see Mackenzie, because she is amazing, and not every dietitian is not the same. And so what I found with you is that you're just everything that I think most of my patients, and I think everybody needs, is someone who doesn't force you on a diet, that works with you to break those cycles of dieting, and just build a healthy relationship with food. Can solve so much. It can solve family issues, it can solve body image issues, it can solve, of course, being able to get stronger and having a great pregnancy. So there's just so much that you're doing, and so I applaud you for all the hard work.
Well, thanks.
That you continue
I'm
to
blushing. Thank you, Colleen. You're so sweet. And where can folks find you?
Yes. And so right now I am just treating patients in person. And so I work at Balanced Physical Therapy and Pilates. So that is located in Charlotte, North Carolina. We are down by the Arboretum. And so I treat, of course, orthopedic injuries, pelvic floor injuries, as well as if you're just looking to do Pilates, and doing like private Pilates as well as group classes. I do both of those as well. So you get a little bit of everything with me.
Awesome. I love that. And we'll put your kind of like the Balanced PT and Pilates website and your social media handles in the description of this podcast episode. But yeah, thank you so much for coming onto the pod, Colleen. Really appreciate you. And thanks so much for all the wonderful advice you're giving today.
Thank you. Oh, so nice chatting, Mackenzie.